Welcome to WGU Prep YouTube channel. Access all practice questions. Healthcare quality improvement and risk management. Practice questions with answers. Question 1. What is the primary goal of quality improvement, QI, in healthcare? A. Reduce hospital costs. B. Improve patient outcomes. C. Increase staff efficiency. D. Enhance technology use. Which one is the correct answer? The correct answer is B. Improve patient outcomes. Explanation. Quality improvement in healthcare aims to enhance patient care and outcomes by identifying areas for improvement and implementing evidence-based practices to increase the effectiveness of care delivery. Question 2. What is a key component of risk management in healthcare? A. Staff training. B. Regulatory compliance. C. Patient privacy. D. Financial audits. Which one is the correct answer? The correct answer is B. Regulatory compliance. Explanation. Regulatory compliance ensures that healthcare organizations follow laws, standards, and regulations to mitigate risks such as legal liabilities, penalties, or patient harm. Question 3. Which tool is commonly used to monitor healthcare quality improvement? A. Risk register. B. Fishbone diagram. C. Control chart. D. Compliance checklist. Which one is the correct answer? The correct answer is C. Control chart. Explanation. Control charts are used to monitor the performance of processes over time, helping healthcare organizations identify variations and trends that need attention for improving quality. Question 4. What is root cause analysis, RCA, used for in healthcare? A. Identify quality improvement strategies. B. Determine the underlying cause of an issue. C. Measure patient satisfaction. D. Evaluate financial health. Which one is the correct answer? The correct answer is B. Determine the underlying cause of an issue. Explanation. Root cause analysis is a method used to identify the fundamental causes of problems or adverse events in healthcare. It helps prevent recurring issues by addressing the root causes. Question 5. Which of these focuses on reducing healthcare delivery errors? A. Risk tolerance. B. Root cause analysis. C. Clinical pathways. D. Benchmarking. Which one is the correct answer? The correct answer is B. Root cause analysis. Explanation. Root cause analysis helps to identify the underlying causes of errors or adverse events in healthcare, enabling organizations to implement solutions that reduce the likelihood of recurrence. Question 6. What is the purpose of patient safety initiatives? A. Increase hospital revenue. B. Prevent errors and harm. C. Improve staff satisfaction. D. Minimize regulatory penalties. Which one is the correct answer? The correct answer is B. Prevent errors and harm. Explanation. Patient safety initiatives are designed to prevent harm and reduce errors in healthcare settings. These initiatives focus on creating a culture of safety and implementing preventive measures to protect patients. Question 7. What does the term risk mitigation mean in healthcare? A. Avoiding patient care errors. B. Reducing the likelihood and impact of risks. C. Increasing operational efficiency. D. Ensuring patient satisfaction. Which one is the correct answer? The correct answer is B. Reducing the likelihood and impact of risks. Explanation. Risk mitigation involves strategies to reduce the probability and consequences of potential risks in healthcare, such as implementing safety protocols, training staff, and using technology to enhance care quality. Question 8. Which process is used to measure healthcare outcomes? A. Patient surveys. B. Benchmarking. C. Clinical audits. D. Control charts. Which one is the correct answer? The correct answer is C. Clinical audits. Explanation. Clinical audits are used to assess healthcare practices and outcomes against established standards. They help identify areas for improvement and ensure that care is delivered according to best practices. Question 9. What is the purpose of benchmarking in healthcare? A. Identify financial inefficiencies. B. Compare performance with peers. C. Enhance patient communication. D. Improve regulatory compliance. Which one is the correct answer? The correct answer is B. Compare performance with peers. Explanation. Benchmarking involves comparing an organization's performance against industry standards or peer institutions. This process helps identify areas of improvement and sets performance goals for the future. Question 10. What role does leadership play in healthcare quality improvement? A. Ensuring compliance. B. Developing policies. C. Driving change and supporting staff. D. Managing finances. Which one is the correct answer? The correct answer is C. Driving change and supporting staff. Explanation. Effective leadership in healthcare is crucial for driving change, motivating staff, and supporting quality improvement efforts. Leaders create an environment that encourages continuous learning and improvement to enhance patient care. Thank you for watching. For more practice questions, subscribe to our website at wgupracticequestions.com.